Good evening, everyone. I'm Dr. Crisanto, and I've been practicing medicine for over 35 years, specializing in geriatric care and vascular health. Today, I want to talk to you about something that affects more people over 60 than you might realize, something that probably brought many of you here today, and something that frankly concerns me deeply because of how often it's misdiagnosed and mismanaged. You wake up in the morning, and you swing your legs over the side of the bed. As your feet touch the floor, you notice it immediately. Your ankles look puffy. Maybe it's your shoes that feel tighter than they did yesterday. Perhaps you go to take off your socks, and there's that telltale indentation around your ankle, that mark that doesn't fade away quickly like it used to. You might even feel a bit of heaviness in your legs, a kind of ache that wasn't there when you were younger. And here's what happens next. You start to worry. You think about your heart. You think about your circulation. You start imagining that something serious is happening inside your body. But I'm here to tell you something today that might completely change how you think about this problem. In the vast majority of cases, and I mean the vast majority, swollen ankles in people over 60 have almost nothing to do with your heart. This is critical information, and it's information that can quite literally change your quality of life if you understand it and act on it. Let me paint a picture for you. I was sitting in my clinic about 3 months ago, and I had a patient, Martha. She was 63 years old. She came to see me because her ankles had been swollen for almost 2 years. 2 years. She'd been to multiple doctors. She'd had EKGs. She'd been put on blood pressure medication, even though her blood pressure was fine. She'd been worried sick about her heart. She'd changed her diet, cut back on salt so much that her food tasted like cardboard. And still, every morning, those ankles would swell. When I asked her if anyone had ever explained her lymphatic system to her, she looked at me blankly. Not one doctor had mentioned it. That's when I realized I needed to do something about this. I needed to get this information out there because the lymphatic system, this incredible network in your body that most people know absolutely nothing about, is probably the culprit in your case too. Now, before I go any further, let me be absolutely clear about something. If you have swollen ankles, you should see a doctor. You should get evaluated. There are serious conditions that can cause swelling, and we need to rule those out. But here's what I've found in my decades of practice. Once those serious conditions have been ruled out, and they usually have been, the answer almost always comes down to your lymphatic system and how well it's functioning in your body. So let's talk about what lymph actually is, because I think this is where most people get confused. Your body is basically a network of highways. You've probably heard of the cardiovascular system, right? Your blood vessels, your heart pumping blood through your body. But there's another system that runs parallel to that, that's just as important, maybe even more important in some ways, and most people have never even heard of it. That's your lymphatic system. Here's a simple way to think about it. Imagine your cells are little apartments, and they need food and oxygen delivered to them. That's what your blood does. Your blood carries oxygen and nutrients to your cells. But here's the thing, your cells also produce waste. They produce toxins, they produce dead cells, they produce inflammatory substances. Someone needs to clean that up. Someone needs to remove that garbage from around your cells. That someone is your lymphatic system. So you have lymph fluid, which is basically the cleanup crew. It picks up all that waste material from around your cells and carries it through lymph vessels to your lymph nodes, which are like little processing centers. Your lymph nodes filter out the bad stuff, kill off any bacteria or viruses that shouldn't be there, and then the clean lymph fluid gets returned to your bloodstream. It's a beautiful system, really, and it's been working in your body since you were born. But here's where the problem starts, especially as we age. The lymphatic system doesn't have a pump like the cardiovascular system does. Your heart is this amazing muscular pump that keeps your blood moving 24 hours a day. But your lymph system? It relies on movement. It relies on muscle contractions. It relies on you actually using your body for it to work properly. And if you're sitting a lot, if you're not moving enough, if you're not exercising, if you're spending hours on the couch or in a chair, your lymphatic system just sits there. The fluid starts backing up. It accumulates. And where does it accumulate most? In your feet and ankles. Do you see why? Gravity is working against the lymph trying to come back up from your feet. Without movement, without muscle contractions to push that fluid upward, it just pools in your lower extremities. That's where the swelling comes from. That's your lymphatic fluid accumulating in the tissues of your ankles. Now, here's another reason why this happens so much in people over 60. As we age, our lymphatic system becomes less efficient. The walls of our lymph vessels don't contract as strongly. Our body produces less movement overall because we're not as active. We're dealing with more inflammation in our bodies due to chronic conditions. All of these factors compound each other, and before you know it, you've got swollen ankles that just won't go away. I want to address something else that I see happen over and over again in my practice, and it frustrates me because it leads people down the wrong path. Someone goes to their doctor with swollen ankles. The doctor takes their blood pressure, normal. The doctor listens to their heart, sounds fine. The doctor checks for varicose veins, maybe there are some, maybe there aren't. And then the doctor says, it's probably nothing serious, just reduce your salt intake. Or even worse, they prescribe a diuretic medication, a water pill. Now, a water pill might seem logical. If you're retaining fluid, get rid of the fluid, right? Wrong. This is where conventional medical thinking can actually make your problem worse. When you take a diuretic, you're forcing your kidneys to dump fluid out of your body. But here's what happens. Your blood volume decreases, your circulation becomes compromised, and your lymphatic system, which is already struggling, has even less fluid to work with. You might see temporary improvement, but you haven't fixed the underlying problem. You've just forced your body to lose water. And now you're dependent on a medication. What you actually need is to fix your lymphatic drainage. You need to get that fluid moving again. You need to activate the system that's designed to handle this cleanup work. And here's where it gets exciting, because this is something you can actually do yourself, starting today in just 5 minutes. Let me tell you about the 5-minute habit that changed Martha's life. She came back to see me 2 weeks after I taught her this technique, and she was amazed. Her ankles were noticeably less swollen, not completely better yet, but significantly better. After a month, she looked like a different person. The swelling was gone. The heaviness in her legs was gone. She could wear her normal shoes again without them being tight. Here's what I taught her, and it's what I'm going to teach you now. This is a combination of lymphatic drainage techniques that work with your body's natural lymphatic system to encourage drainage. The technique involves 3 main components, and together they take about 5 minutes. If you do this once a day, preferably in the morning when you wake up, you will see results. The first component is what I call the diaphragmatic pump. When you breathe, your diaphragm, which is the muscle beneath your lungs, moves up and down. Every time your diaphragm moves down, it creates pressure that pushes lymph fluid upward through your lymphatic vessels. Most people don't breathe deeply enough to activate this pump. They breathe shallowly, from their chest only. We need to change that. Here's what you do. Find a comfortable position, sitting or lying down. Place one hand on your chest and one hand on your belly. Now, breathe in slowly through your nose, and as you do, imagine that you're breathing all the way down into your belly. Your hand on your belly should move outward as you inhale. Your hand on your chest should barely move. You're doing what's called belly breathing or diaphragmatic breathing. Exhale slowly through your mouth. Do this for about 1 minute. That's 10 to 12 deep breaths. What's happening here is that you're activating your lymphatic system through respiration. That movement of the diaphragm is actually pumping lymph fluid upward from your lower body toward your heart. This is so important, and it takes just 1 minute. But we're not done yet. The second component involves what I call lymphatic massage or manual lymphatic drainage. This is gentle, it's easy to do, and it's incredibly effective. You're going to start at your feet and work your way up. Here's how it works. Sit on your bed or on a couch with your legs stretched out in front of you. Or you can do this standing, whatever is comfortable. Start with your right foot. Using the palm of your hand or your fingers, you're going to make gentle circular motions on the bottom of your foot. These circles should be moving in the direction of your calf, pushing the fluid upward. Don't press hard. Lymphatic vessels are very close to the surface of the skin, so you don't need to apply much pressure at all. In fact, if you're pressing hard, you're probably not doing it right. Think of it as gentle, rhythmic, encouraging the fluid to move. Spend about 30 seconds on the bottom of your foot, then move to the top of your foot and do the same thing. Now move to your ankle. This is important because this is where the fluid is accumulating. Using both hands, place them on either side of your ankle. Make those same gentle circular motions, but now you're working from your ankle up toward your calf. Work your way up both sides of your ankle, spending about 1 minute here. This is the area that needs the most attention. Now move to your calf. Place your hands on your calf and make those same gentle circular motions, working from your ankle up toward your knee. Spend about 1 minute on each calf. You should feel a slight warming sensation, but you shouldn't feel any pain. If you feel pain, you're applying too much pressure. Here's why this works so well. Your skin is covered with lymphatic capillaries, which are incredibly small lymph vessels. When you apply gentle pressure and movement to the skin in this upward direction, you're actually manually stimulating these vessels to contract and push fluid upward. You're doing the work that your lymphatic system would do if you were moving enough. You're essentially giving your lymphatic system a helping hand. The third component is elevation. This is the easiest part, but it's also one of the most important. After you've done your breathing and your massage, spend about 2 minutes with your legs elevated above your heart. The easiest way to do this is to lie on your back on your bed with your legs up on a stack of pillows or on the arm of a couch. Your hips should be at about a 90-degree angle. Your legs should be elevated so that your ankles are above the level of your heart. Gravity is now working with you instead of against you. When your ankles are elevated, the fluid in your feet and ankles will naturally want to drain back toward your heart. This is the perfect time to do some deep breathing again. Go back to that diaphragmatic breathing we talked about. Breathe deeply and slowly. Every breath is pumping lymph upward. Every second that you're in this position with your legs elevated, you're helping your lymphatic system drain. So let me recap the 5-minute habit. 1 minute of deep diaphragmatic breathing, 2 to 3 minutes of gentle lymphatic massage starting at your feet and working up to your knees, 1 to 2 minutes of elevation with deep breathing. That's your 5-minute routine. Now, I want to tell you about the science behind why this works, because understanding the mechanism will help you stay committed to doing this, even on days when you're busy or tired. Your lymphatic system contains special cells called endothelial cells that line the walls of your lymph vessels. These cells have tiny valves on them that only allow fluid to move in one direction, upward toward your heart. When you apply gentle pressure to the skin and tissues, you're stimulating these cells to contract. You're opening those valves and pushing fluid through. Additionally, your lymphatic system contains thousands of tiny muscles called smooth muscles. These are involuntary muscles, meaning you can't consciously control them the way you control your biceps, but they respond to movement. They respond to massage. They respond to elevation. When you activate these muscles through this routine, you're activating your body's natural waste removal system. I've seen remarkable transformations in my patients who commit to this 5-minute habit, not just in terms of reduced swelling, though that's certainly important. I've seen improvements in energy levels. I've seen improvements in how people feel overall. Why is that? Because remember, your lymphatic system is your body's garbage collection system. When it's not working properly, that garbage accumulates. That waste material that should be removed from around your cells just sits there, causing inflammation, causing discomfort, causing that feeling of heaviness and fatigue that so many people over 60 experience. When you get your lymphatic system working properly again, you're removing that garbage, you're reducing inflammation throughout your body, you're improving the environment around your cells. That means better cellular function, better energy, better overall health. This isn't just about your ankles, this is about your whole body. Let me tell you about another patient, Robert. He was 68. He'd had swollen ankles for 3 years. But what was interesting about Robert was that he also had chronic fatigue. He was always tired. He couldn't walk as far as he used to because his legs felt heavy and aching. His doctor told him it was just part of getting older. That's what really bothers me, when doctors just attribute everything to aging without actually investigating the underlying causes. Robert started doing this 5-minute routine, and within a week, he noticed something remarkable. His ankles were less swollen, yes, but also, he felt more energetic. He didn't feel that heavy ache in his legs anymore. After a month, he was walking farther than he had in years. His wife said she had her husband back. That's the kind of transformation I'm talking about. Now, I want to be honest with you. This 5-minute habit is not a magic bullet. For some people, especially if they've had swelling for a very long time, it might take longer than a few weeks to see full results. But I've never had a patient who followed this routine consistently who didn't see significant improvement within a month. And the best part is, there are no side effects. There are no medications to buy. There are no procedures to undergo. It's just 5 minutes of your time using techniques that your body was designed to respond to. There are some additional things you can do to enhance the effectiveness of this routine. Movement is critical. I can't stress this enough. Your lymphatic system relies on movement to function. So beyond the 5-minute routine, try to incorporate more movement into your day. It doesn't have to be intense exercise. A gentle walk for 30 minutes a day can make an enormous difference. Swimming is fantastic because the water provides gentle pressure on your skin and helps move lymph. Even just standing and moving around more than you currently do will help. Hydration is also important. Your lymph is mostly water, so if you're dehydrated, your lymphatic system can't work properly. Drink plenty of water throughout the day. I recommend at least 2 liters a day, more if you're active or live in a hot climate. Stay away from excessive salt, but don't eliminate salt completely. Your body needs salt to regulate fluid balance. The key is moderation. Avoid tight clothing around your ankles and lower legs. Tight socks, tight pants, anything that restricts the circulation in your lower legs can impede lymphatic drainage. Wear loose, comfortable clothing. Keep your legs uncrossed when you sit. Crossing your legs can restrict blood flow and lymphatic flow in your legs. Try to keep your body temperature comfortable. Cold temperatures can cause your blood vessels to constrict, which impairs circulation and lymphatic function. Keep warm, especially your legs and feet. Some of my patients find that spending time in warm water, like a warm bath, helps with their symptoms. The warmth dilates blood vessels and lymph vessels, improving drainage. Consider your diet. Certain foods are known to increase inflammation in the body. Processed foods, foods high in sugar, foods high in unhealthy fats, these can all increase inflammation and make swelling worse. Focus on anti-inflammatory foods. Eat plenty of fruits and vegetables. Include omega-3 fatty acids from fish. These have natural anti-inflammatory properties. There are also some herbal remedies that have been traditionally used to support lymphatic function. Horse chestnut seed extract has some scientific evidence supporting its use for lymphatic congestion. Ginger and turmeric are natural anti-inflammatories. Some people find that these help. However, always check with your doctor before taking any supplements, especially if you're on other medications. If you're overweight, losing weight can significantly improve your swelling. Extra weight puts additional pressure on your lymphatic system. You're asking it to drain fluid from a heavier body, which is harder work. Losing even 10 or 15 pounds can make a noticeable difference. One more thing I want to mention, and this is important. If you have one ankle that's swollen significantly more than the other, or if your swelling is accompanied by redness, warmth, or pain, or if you develop swelling suddenly, you need to see your doctor. These could be signs of a blood clot or an infection, and these are serious conditions that need medical attention. The 5-minute habit is fantastic for chronic low-grade swelling, but it's not appropriate for acute conditions. I also want to talk about compression socks or stockings. Many of my patients ask me about these. Compression garments can be helpful, especially during the day. They provide external pressure that helps move fluid upward from your feet and ankles. If you decide to use compression socks, make sure you're using the right compression level. Most people with simple ankle swelling do well with mild compression, around 15 to 20 millimeters of mercury. Talk to your doctor or pharmacist about which level is appropriate for you. What I love about this 5-minute habit is that it's something you can do consistently, something you can integrate into your daily routine, something that gives you back a sense of control over your health. So many people feel helpless when they have a chronic condition. They think they have to take medication or accept it as part of aging. But this is something you can do. You're taking an active role in your health. You're using your body's own systems to heal itself. I had a patient once tell me, after she'd been doing this routine for several months, that she felt like she'd gotten her life back. Her swelling was gone. She felt energetic again. She was able to do things she loves to do, like gardening and spending time with her grandchildren, without that constant concern about her ankles. That's what I want for every single one of you. The fact that you're here, listening to this information, tells me that you're ready to take action. You're not willing to just accept swollen ankles as an inevitable part of aging. You're willing to try something new, something that actually works with your body instead of against it. That's admirable, and I believe that commitment is going to pay off for you. Before you leave today, I want you to commit to trying this 5-minute routine for just 1 week. Not a month, not forever. Just 1 week. Do it every morning when you wake up. Keep a simple log of how your swelling looks each day. You'll be amazed at the changes you see. Most likely, you're going to feel so much better that you'll want to continue. And if you do continue, if you make this a daily habit, you're going to see those swollen ankles diminish significantly. I also want to encourage you to share this information with other people in your life who might be struggling with the same issue. So many people are suffering unnecessarily because they don't understand their lymphatic system. They don't know that their heart is probably fine, that their problem is actually fixable with simple, natural techniques. Be an advocate for your friends and family. Share what you've learned today. Please subscribe to my channel. I post new health information for seniors every week. I cover topics like joint pain, sleep issues, circulation problems, and so much more. All of these topics are addressed from the perspective of understanding how your body actually works and how you can optimize your health naturally. Subscribe so you don't miss any of these videos. And please, leave a comment below. Tell me about your experience with ankle swelling. Have you tried any remedies? What have you found helpful? Do you have questions about this 5-minute routine? I read every single comment, and your feedback helps me create better content. If this video helped you, let me know. If you're going to try this routine, come back in a few weeks and tell me how it went. Your success stories inspire me to keep creating this content, and they inspire other people watching to take action themselves. Thank you so much for watching. Thank you for taking your health seriously. I'm confident that if you follow this 5-minute routine consistently, you're going to see improvements in your ankle swelling, you're going to feel better, and you're going to understand your body better. That's what this is all about, empowering you with knowledge so that you can make better choices for your health. Take care of yourselves, and I'll see you in the next video.